Once again, good afternoon and welcome to today's webinar, Mental Health Stigma at Work, Why HR has a Role in Promoting Wellness, Support, and Compliance, presented in partnership between Western Governors University and Albany Law School. I'm Tom Rosenberger, Assistant Dean and Director for Online Programs here at Albany Law. Today, we're pleased to welcome three subject matter experts to our virtual stage. Glenn Liebman, CEO of Mental Health Association in New York State, Alexandra Howell, partner at Potomac Law Group and adjunct professor of human resources, law leadership and policy here at Albany Law, and Ashley Duggar, associate dean and director of HR management and organizational psychology programs at WGU. I have just a few housekeeping items to get us started. Closed captioning is available during the webinar, and you can find the controls for that on your webinar screen. This webinar is being recorded and will be posted afterward online publicly. And if you have a key question during the webinar that might be relatable to other audience members, please feel free to use the Q&A button, the Q&A panel, and the panelists and I will do our best to monitor that panel and to respond to questions as appropriate. I'd like to recognize today's longtime partner, the Capital Region Human Resources Association, which is the Albany area SHRM chapter, with whom we regularly collaborate. We invite human resources professionals locally and nationally to participate in this ongoing HR practice webinar series. CRHRA offers opportunities for learning and networking through their weekly newsletter, events, and a whole lot more, and you can contact them directly to get involved. Albany Law School offers 5 fully online graduate programs designed for the working professional, whether or not you have any prior legal education. All programs offer a 9-credit advanced certificate, a 30-credit Master of Science, as well as a 24-credit specialized LLM for attorneys. Courses are 7 weeks long. You can choose from 6 start dates per year, and we will work with your organization's tuition reimbursement payment policies, and we offer guaranteed tuition discounts through partnerships with various employers. We are excited to present this webinar with the nonprofit accredited Western Governors University, as I said. Thanks to our partners at WGU, including Dr. Duggar for sharing her expertise with all of you today. And welcome to everyone in the audience from the WGU College of Business. Without further ado, let's jump right in. And to get things started, allow me to introduce our moderator, Glenn. Glenn, why don't you introduce our other esteemed panelists and maybe start by kicking us off with an overview from your perspective of the current landscape around mental health in the workplace, the types of issues your organization is dealing with, and why this all matters. Okay, we will get Glenn.
Yep.
Okay. There you are, Glenn. Did you?
Great. Thank you. Yep. I'm all
Perfect.
good. Thank you. No, thank you very much, Tom. I appreciate it. And I just really want to thank you for this opportunity. I want to thank Albany Law School and Western Governors University for this opportunity. I'm sorry, just bear with me for 2 seconds. We are here today. We have 2 expert panelists, and they are experts. We've had many opportunities over the last few months to talk, and they really are experts, and you'll hear from them shortly. I'm just going to do a brief bio of them. Ashley Duggar is the Associate Dean and Director of HR Management and Organizational Psychology Programming at Western Governors University, and Alexandra Howell is a partner at the Potomac Law Group and adjunct professor at Albany Law School. And really, we're very pleased to have them with us today. So my name is Glenn Liebman. I'm the longtime CEO of the Mental Health Association, New York State, commonly known as MHANYS. We're an organization that's comprised of 26 affiliates in 52 counties throughout New York State. But a lot of what we do on the ground is we do a lot of advocacy, we do a lot of training, we do a lot of programming, and a lot of our work is, very public, and it's not only specific to the mental health, but it's much more broadly than that. It's about the whole entire outreach around community health and mental health. So we'll say that to start, this to me is an incredible number. So we are in a country, as we know, a country that is oftentimes divided when we can't get 90% of people to agree if the earth is flat, if the ocean is blue. Yet the Washington Post 5 months ago did a survey, and 90% of Americans believed we're in a mental health crisis. That is an incredible number when you think about it. Now, this all, obviously, COVID had a lot to do with this. But prior to COVID, 1 in 5 adults and children have a serious mental health issue over the course of a year. Now, that's a pretty consistent number over the last number of years prior to COVID. But after COVID happened, we had this incredible, as you can imagine, the percentage went up dramatically to close to 40% of people having a serious mental health issue. And, obviously that makes sense. The isolation of COVID led to anxiety and depression, increases in substance use, increases around suicide completion, sadly. There's just, when we said that, we've often said that COVID was not just a health crisis, a public health crisis, but it was a mental health crisis as well. The number that is most jarring of all the numbers that have come out, the number that's most jarring that jumps out is that 30% of young women under the age of 18 have had thoughts of suicide completion. It's a remarkable number, and it's a very incredibly sad and difficult number. And the reason I bring that up is because the mental health crisis has dramatically impacted the work environment. If you're a family member of somebody who is thinking about completing suicide, you are likely missing work. And if you're not missing work, when you're at work, you're likely not thinking about work. So the productivity during COVID has around mental health issues is just, it's remarkable. And the number that we have often been citing around the country is that there's over $200 billion a year lost in productivity because of mental health issues. It's a concern that has both enormous economic as well as moral consequences. So this is the kind of framework we're talking about here. Now, over the next hour, our experts will tackle some of these complex issues through a series of questions that we've developed. Then we will talk about resources that are available for those in the work environment, because the paradigm has shifted. People are, as the numbers have sadly increased because of COVID, the positive is that people are talking about it much more openly. We're normalizing conversations about mental health in ways that we never, ever envisioned before. And that's a real positive. And we'll talk about that. And finally, at the end, well, throughout, we'll also be taking questions from the audience. So we're going to start right now with Alexandra. Alexandra, good afternoon.
Good afternoon. Thanks for having me.
Sure. So the first question we have for you is, how does the, no, I'm sorry. My mistake. Ashley, we're going to you first. Sorry. Ashley, sorry. Good afternoon.
We're adaptable. We'll flex.
I appreciate it. I appreciate it. Thank you. But so we'll start with Ashley. Ashley, what are the first steps an HR office can take to start building an effective mental health wellness program?
Yeah, I mean, to me, I think the best first step, whether you already have a pretty robust or what you feel is a pretty robust set of benefits offerings and support resources, or you feel like you're starting from the ground, is just to really do a strong strategic analysis of what you have now, but also survey your employees on not only what they're aware that you offer, but what do they need? Because I think a lot of times we can make assumptions based on our own experiences with mental health, or not having a lot of exposure to mental health and how it impacts employees in and out of the workplace. And we tend to make some assumptions around what we feel employees need versus getting it directly from them on how we can better support them at work. So for HR, I mean, I know we say do a strategic analysis of everything now, but that's really, I think, the best place to start. What are you offering in your benefits package? Are your benefits diverse? Are they inclusive? Do they have a pretty robust mental health support, just like you support physical health? Taking a look at things like even your paid time off, because I feel like that's an area I hear from people a lot, that they don't feel comfortable using PTO for mental health and for that time, even before they get to a place of needing it, but using it before it becomes a crisis. I would also look at just your overall org culture. Is there psychological safety there? Do employees feel safe and feel confident bringing issues to HR, to their leaders, talking about these sorts of conversations that for a long time and still do carry a lot of stigma or perceived stigma for many employees? Do they feel safe bringing that up? If not, start taking those steps in HR to create that psychological safety and that trust with your employees. And then I think also just educating the business leaders and the employees on the impact that mental health has on the workplace, so they see the really strong return on investment for making this a priority.
Great. Thank you very much. So, Alexandra, from your perspective, how does the law view mental health? Do the same laws that govern physical health issues, from privacy to accommodations in the workplace, do they also apply?
They do. Generally speaking, the law views mental health and physical health in the same way. So in terms of discrimination and in terms of disability, practically speaking, when it comes to mental health disabilities, and just having a mental health issue doesn't mean that you have a mental health disability under the law. But by and large, once you explain to the employer or tell the employer directly or indirectly that there is a disability, you become part of what's called a protected class. And so that basically means that you're entitled to certain legal protections. Everybody that works has the right to be free from discrimination. But when it comes to mental health, you're talking about the right to be treated the same as somebody who doesn't have a mental health disability. Mental health issues are not necessarily visible to the naked eye, right? If someone has a physical ailment, sometimes you can see that. When it comes to mental health, it can present itself in different ways that are often seen by employers as inappropriate behaviors. So things like aggression, fatigue, things like difficulty concentrating, having difficulty prioritizing tasks. Those kinds of issues tend to be viewed by employers as productivity problems. And so if you're struggling with something like ADHD, for example, which may or may not be a disability under the law, you can think of or consider communicating that to the employer so that you become a member of a protected class. And that means that you're entitled to certain legal protections, the right to a reasonable accommodation if you need one. And just also having transparency with your employer can sometimes help drive compassion in the workplace. But it's not without risk, of course, for the employer's perspective, because when you know about a mental health disability, then there are certain obligations that you might have. But by and large, when you're talking about physical and mental impairments, the law views them as the same. A disability is a disability.
Great. Thank you. Thank you very much. So Ashley, getting back to you, offering resources is one thing, getting employees to participate is another. How does communication play a role in getting buy-in across an agency?
Yeah, I mean, the communication, I think, to me is really awareness, but it's also a way to really engage with the employees that I think over time can build trust in and of itself in that communication when it's really open, when you're being transparent, and I think for HR, willing to be vulnerable yourself. So many times we have this view of HR and organizations that they're these strict enforcers, and HR as an industry has worked so hard to shift that perception. And we're seeing so many positive places of movement with shifting that perception. But I still hear from people all the time, friends, family, even in my HR network, that say, our employees don't come to us unless there's a problem. And so I think just setting the stage with ongoing, continuous, open communication is so critical to building the trust that employees need to have to come to you with the more serious things, like Alexandra mentioned, to disclose a disability, to ask for an accommodation, to work through that interactive process. They have to trust that you care about them and care about their experience as an employee and their well-being, in many cases, to even take that first step and have that initial conversation. But I think specific to communicating about the importance of mental health at work, the resources available, I find resources that we have at WGU that are incredible that I didn't even know about sometimes. And our team does an amazing job communicating, but it's like in the day to day, it's so easy for things to get buried, right? And so if you only see it once, or you're caught up in these other day-to-day tasks, you have to have, I think, varied communication for people to engage with different ways. When we think about learning styles, the same way goes for how you receive information, not just in a training, but if you're feeling inundated and you're already feeling burnout and kind of at the max of your stress level, whether it's outside of work or with work, and you start getting these emails, you're probably less likely to engage with them, read the communication, take the next steps.
Yeah.
But I think when you have a mix of communication methods and they're continuous, they're conveniently accessible. So if you have a way to, if you have a mobile app for your employees or through your HRIS, it's a great place for HR to put pop-up messages that are very succinct, that make a call to action. So it isn't just, we have this, but you can use this now by doing XYZ.
Sure.
And I think the other piece that's really impactful with communication is employees that are comfortable sharing their experience, engaging with the resources you offer or resources you don't offer, but could be helpful to other employees. That can sometimes be so much more impactful than just sharing the information as an organization, but having that real life experience behind it to say, hey, Glenn, I was struggling with burnout at work. I was struggling with anxiety, and here are some resources I use. Here's how I engage with them. Here's how I use them day to day. I think that can be incredibly impactful when employees hear from their counterparts that they're actually utilizing the things available to them and that it's making a difference.
Yep. No, that's a very good point. And, you know, I think, you know, I pointed this out in the beginning is that, and I'm sure you're seeing this from your perspective, is that so many more people are open about talking about mental health issues, you know, really since COVID and a lot of other reasons as well, that there really has been this sort of shift around people talking about it. And that's really obviously from an HR perspective, a very positive thing. So thank you for that. Alexandra, what would you say the legal implications of an employee sharing a mental health issue in the workplace? Does your employer have the right to know about a past mental health issue or an existing mental health concern?
So in short, the employer doesn't have a right to know, but sometimes it's to the benefit of the employee to share. So the Americans with Disabilities Act requires an employer to provide reasonable accommodations to qualified individuals with disabilities. And that includes people that are applying for the job and also people who are actually employed. So a reasonable accommodation can include lots of adjustments both to the application process, to the working environment, things like hours, things like days off, PTO, how information is communicated to employees and things like that. So when you share that you have a mental health issue in the workplace, it's different from saying I need an accommodation. So if somebody just shares, I have this mental health issue, then for the employer, it sort of is okay, well, you know, that's fine. It's when an employee asks in some way, directly or indirectly, for an accommodation that the employer has some obligations. And it's important to understand the difference because, you know, if an employer hears that someone has a mental health condition, they might perceive them as having a disability, which can trigger the discrimination piece that I was talking about earlier. So you don't want to assume that someone needs something unless they've communicated to you that they need it. Because the protection goes as far as like depriving somebody of job benefits that they might otherwise be entitled to. You think that you're helping the person by reducing their workload, but what you're really doing is discriminating against them because you're giving them less job opportunities by giving them less, you know, difficult assignments or things like that. Conversely, an employee that does say that they need something, as an employer, you have to have a process for that. So it's important to have your HR team and all of your supervisors to be trained on what that process looks like and what is required, because once a supervisor knows that someone needs an accommodation, the employer knows that they need an accommodation, whether or not that supervisor communicates that to anybody else within the organization. So having a process, a policy that's written, that's understood by the staff, the team, particularly with supervisors, is key. And so, when it comes to sharing, the question, you have a lot of questions around privacy and what are the obligations of the employer there. So you have to make sure as an employer that you're safeguarding privacy first and foremost. No one has a right to know about anybody's medical history with their mental health, just the same way they have no right to know about a person's medical history with their physical health. But employers can ask if a reasonable accommodation is requested, an employer can ask for documentation. So also having that piece around training, what constitutes something that an employer is entitled to know because someone's asked for an accommodation, and where that line really is.
Thank you. That's very, very helpful. Thank you. Going back to you, Ashley, if a person is unable to complete their work because of an existing mental health concern, what is the responsibility of the employer to ensure they can succeed in this position? What types of resources should the employer consider?
Yeah, this one can be so tricky. I think the most commonly heard phrase in HR is "it depends." And I think this is one of those areas, and it segues really nicely, Alexandra, with what you were mentioning, because the thing that stood out to me is it doesn't necessarily correlate to a diagnosed illness or disability when we may be experiencing temporary, mental health concerns. So there are a lot of variables there to consider. But I think when you're looking at this specific case of someone isn't completing their work, we know so little about the people around us in terms of what they're dealing with in and outside of work on a day-to-day basis. And so I think first, just never assume that if they're not completing their work, there is a larger diagnosed illness or disability. We just cannot make that assumption. And like Alexandra said, they don't have to disclose that, and what they disclose is up to them. But when we think about how personal stresses and responsibilities or work stresses can temporarily also impact our performance, I think it's important for HR not to try to diagnose. So I've seen this a lot where people can jump to conclusions and say, well, I've seen this example before and it was XYZ, and they try to approach it that way. But that is one role HR does not have to play, is diagnosing mental health concerns. I think first, sitting down with the employee and going into the performance of the essential job functions and starting there. If you have worked really hard, that so many HR professionals are doing, to build that trust and those relationships, I've had the experience where sitting down with employees just to start with the job and just ask the open-ended questions of, help me understand why this isn't getting completed, or what can I offer to support you better? What resources might you need to do this? A lot of times it opens the conversation up to where they may disclose whether it is something that could be classified as a disability or accommodation need, or if it's something where it's just like, hey, you know what? I've started taking care of my parents lately. I've had that come up before. I had another person say, my son got deployed and I haven't been able to focus on anything. And so there are a lot of nuances that we just never know, all the things people are dealing with. And so I think when you can set the groundwork for them to open up to you, it might be a little, they might, start to just really share. Sometimes that happens. But I think creating a space where they feel comfortable sharing with you, so that then you can have an honest conversation about, what can HR do? What can the business do to support them? And not just from a compliance perspective, but I was doing a certification recently and they were talking about how most reasonable accommodations, and Alexandra checked me on this, were something like $400 or less on average. A lot of them were zero. And an employee had come in and they were going through chemo and it was causing them to be very distracted. And they said, I work in a very high traffic area and I can't get my work done. all they needed to do was move the person's desk and workstation to a quieter area that they felt comfortable with. And the performance got back on track. And that was all they needed in terms of accommodation in that particular instance. So I think when we go to the job functions, we ask them those open-ended questions to help share with us the why behind, why the work isn't getting done, why they're not getting things done, whether it's due to a disability or a specific mental health concern or not. That's part of what reinforces HR is here to support the business, but also the employees. And I don't think you can really be successful in HR if you don't care about and balance both. And employees need to feel that you're really asking, not just because, yeah, we want to know why this work isn't getting done so we can help support you and support your team, but we also want to know, what do you need for a healthier experience, for more support, so that you feel like you can engage with your work.
Great, thank you. And thank you, Ashley, because I know I didn't ask the questions in the progression originally, so I'll get back to that. So
This is an exercise for us to be adaptable and resilient.
That's what it was, a test. That was totally, I actually planned that out, so it was a test.
I just wanted to add one thing to what Ashley said, if that's okay. There is a difference between saying, like, having a person who's, in the workplace having a performance issue, having a difficulty doing one particular job, or having difficulty managing stress at a job is not necessarily like an actionable disability that the employer has to resolve. But when it comes to, just practically speaking, everybody really wants the same thing. Employees want the business to do well because that helps give them job security and purpose and all those things. Employers want employees to do well because, for the exact same reasons, they want the business to function. They want everybody to stay, longevity, all those things. And having HR know the difference between an actual disability and just difficulty performing the job. And also, to your point about accommodations, and they have to be reasonable. And often, the employee doesn't need to suggest the accommodation that they need. So it could also be HR's role to think of, to brainstorm with that employee during their interactive dialogue about what sorts of things would help that employee perform better, whether or not they have an actual disability under the Americans with Disabilities Act, or they don't.
Thank you. So the next question is for you. Are there any recent cases about mental health that may affect negatively or positively how these issues are viewed in the workplace?
Yeah, so I think it's important to look at, case law trends. As we started the discussion, as a country, we're getting better at understanding mental health, understanding disabilities, and understanding how mental health disabilities can affect job performance. And I think overall, the law has kind of followed that. So, just anecdotally, when I was a child, I had a parent with a very serious mental health disability, and there were really no protections at that time. If there were protections, they weren't really followed. Like, employers weren't educated. We didn't know how mental disabilities could spill over into the workplace. And in my experience, that inability to understand both what one's entitled to and working and having my parent work in organizations where mental health was not well understood resulted in perpetual unemployment, which can often exacerbate mental health issues, right? And we're talking about taking care of people, and we spend most of our time at work. So I think that understanding has sort of followed in the law. So our recognition of ailing mental health as a disability as being the same as ailing physical health as a physical disability has resulted in some changes to the legal landscape. In many cases with mental health, the employee has to establish that they have a disability. So that's kind of where it's not as easy to do as you'd think. So a lot of the cases, center around whether an accommodation was given, should have been given, whether discrimination occurred, starts with the question of whether or not that person has a disability. So just because one person has PTSD and another person has PTSD doesn't mean that both employees have a disability. So it's important, the case law has kind of crafted some general trends in making sure that people understand what exactly a disability is and what is necessary to establishing that. And it has to substantially limit an activity for that employee at that time. So as we know, with mental health, right, sometimes mental health diseases are regulated, and sometimes they're in a state of irregulation. So it depends on the time period, it depends on the person, and it depends on, you know, what is actually being manifested in the workplace. There are some cases out of the Ninth Circuit with ADHD. For some people, ADHD is a disability. And in one particular case, it didn't qualify as a disability because it doesn't substantially limit this person's ability to interact with others. So a condition that limits an individual from performing only one job, as I said earlier, isn't necessarily a disability. And then, you know, a condition like anxiety that maybe limits the ability of someone in their outside life activities from performing the essential functions of their job does constitute a disability and might qualify as an accommodation. The other thing about accommodations is sometimes accommodations are not reasonable. Sometimes, you know, what is requested by an employee is not something that an employer can offer. And sometimes, you know, that interactive dialogue is key. And so the case law is kind of evolving in that way as well.
Right. Thank you. Thank you. And thank you for sharing, because we've certainly witnessed these trends change, not only COVID. I mean, over the last 15, 20 years, we've gone after, our organization, several others have gone after the whole issue around behavioral health parity, treating insurers, treating behavioral health the same way you're treating a medical or surgical benefit. And it's really evolved. Yeah, I've got to say that there is much more, not that there are certain situations that are still discrimination still exists, but now there is so much more ability to talk about it and so many more resources than there were, and really an acknowledgement and an understanding by folks across the board about the importance of understanding mental health in terms of the impact around physical health as well. So thank you for sharing that. Ashley, I want to get to the first set of questions originally posed. Why should organizations prioritize putting the human and human resources, making conversations around mental health more collaborative and commonplace?
Yeah, what we mentioned before about HR has this dual responsibility, both to the business, but also to the employees. You know, I think that when we see the tangible and the more qualitative sort of impacts when mental health concerns are going unaddressed at work, of course, it impacts the business in these quantitative ways with usually higher absenteeism, less productivity. To Alexandra's point throughout, there can be potential compliance concerns, you know, but it also does things like impact your company reputation. That's going to impact your recruiting and your retention. I know when I've worked places in the past where the workload was just so overwhelming. And I remember one job was one of my first jobs years ago. We were working at 3 and 4 in the morning regularly to get through our workload, and our leaders knew, and you know, we kept getting more, and we had something like 86% attrition, and it just kept going up and up and up. And we all kind of finally threw up our hands and said, mentally and physically, I cannot do this. And everyone just, you saw them kind of trickle out. And, you know, we still keep in touch, a lot of us. And of course, this was, you know, 15, 20 years ago, but we talk about how that has shaped where we want to work. You know, we look at the org culture in a new way when you've had that sort of experience where not that something external was being brought into work from a mental health concern, but work plays a part in our mental health, a huge part in it. You know, it shifts your perspective, and salary and benefits are always going to be important to the majority of employees, but we've seen a huge shift even before COVID, but only impacted and compounded by COVID, where employees across all generations are putting a stronger emphasis on the org culture, on how people are treated when they're looking for places they want to work, deciding where they stay working, if they refer other candidates in their network that would be a really great fit for a position. You know, if you work somewhere where you're feeling constantly burnout and overwhelmed and not supported, or there's a really toxic culture, you could have an amazing candidate that could do wonderful things at that business, but you're probably not going to refer them to work there, even if the salary is great, even if they get to work from home, even if the benefits are fantastic. if you feel like the way you're being treated as an employee is impacting your mental and or your physical health, I mean, there are all of these other impacts that businesses are starting to take note of, but I think need to still recognize more. And, how we work, when, where we work, all of that plays a really significant role on our overall stress levels, overall health and wellness. Those days where you just go home and kind of stare at the wall because you're so drained, you're probably not going out and doing that CrossFit workout, or, you're probably ordering DoorDash instead of cooking something a little healthier. And I'm not saying I have done that, but, I think that we really in HR especially have this unique ability to impact how people feel at work. And ultimately that trickles down into how they engage with their friends, with their families, with their communities. And there is this sort of snowball effect where if they feel like they're going to a place of work that they can engage, they're being treated positively, it feels healthy for them. Not that it's never stressful, but that they have the tools and resources to work through those harder periods, and that overall it's a positive experience. That really does impact all other facets of their life and the people that they interact with.
No, those are all excellent points. And shout out to the gig economy, though. We want to keep DoorDash going, but
I'm single-handedly keeping this going.
But I will say I spot on in terms of that. And we said, we've had a recent growth in our organization, and I got to say that people, granted, we're a mental health organization, but the questions we get from people who are being interviewed are so different than the questions we got even 5-10 years ago about culture, about how the agency, again, of course, money and benefits are huge, but it's less about that. And it's much more about the culture of an agency. So it really is, a trend. I mean, again, it's not just COVID specific, things were moving in that direction anyway, but a few of those things were very COVID relatable. And I think that really has changed and shifted a lot of the ideas, especially among young people as well. So
yeah.
Excellent.
I just wanted to add to that. I think, for any leader or just any employee, if a colleague is coming to you, if someone that reports to you is coming to you, don't look at just the words, but look at their body language, even if you're virtual, think about the tone. And I know I've had situations with employees on our team over the years where we can tell, even though we work remotely, we have worked really hard to build strong relationships and connect with each other. Our team loves to use humor to connect. So for me, my team knows if I'm not laughing, I'm probably having a pretty hard day. I might need some extra support that day. And then conversely, when people's tone changes, even if it's through a chat, you can usually tell when someone is interacting with you different than how they normally do. Don't feel scared to just say, hey, this doesn't sound like you. Do you want to talk? I'm here if you want. You don't have to. That's okay. But I am here if you want to. And sometimes they just need someone to vent to for a few minutes. Sometimes they need to take that leap of trust and say, you know what, I'm not okay today. And here's what's going on. And you never know how other people's experiences can help you. And so I think it's like you have to be willing on both sides to open up a little bit and just take that first step of saying, I'm here. Things sound like they're not maybe okay today. And maybe they are, but do you want to talk about what's going on?
And I just to add to that, I think when it comes to culture, as lawyers, we're always saying like, put it all in writing, put all your policies in writing, and that is key. But you really want to don't put anything in writing about a culture that you're not willing to put into action. And so there has to be a connection between the policy and how it's implemented. If you want to have a policy that, opens or fosters, and you should, has this open communicative process where HR and employee work hand in hand together to support the organization, you want to make sure that employees perceive that culture in a real way. If your organization is taking the position that every accommodation that is requested is an argument between employer and employee, that culture is not spilling over into the actual workplace. And so if you want to talk about having a culture that, that promises open and willing communication, that, allows for safe spaces for employees to communicate the things that are bothering them about the workplace, it's really important that they perceive that culture too. And so I think, practically speaking, sort of checking in and asking employees either, anonymously, how they would describe the company's culture is really important. And then making the adjustments to the policy and to the training of supervisors in HR to make sure that that culture is perceived by everybody that works there is also really important.
That's an excellent point. So, Alexandra, what legal risks should employers be aware of as they review or revise their policies on mental health? Is an appropriate question.
Yeah. So policies need to be, so there's lots of layers of law, as we all know. Policies have to first be compliant with federal law. And the other thing that's important, so federal law usually establishes a floor of what's necessary, particularly with the Americans with Disabilities Act, with, discrimination laws. So you have a floor established by the federal government. And so your policies have to make sure that they're compliant with federal law. But most states like New York and localities such as New York City, a lot of counties throughout our state and throughout the country also have higher standards for what must be included in a policy. And so, when you are revising your policies, I think it's really, really important to have all workplace policies revised regularly by employment lawyers, qualified employment lawyers. And sometimes that's in-house counsel and sometimes it's not, because sometimes in-house counsel is really corporate counsel and they serve that sort of corporate role. Having an expertise in employment law is critical because employment lawyers obviously study the trends and changes in employment law, throughout the years. So I think making sure that your policy is reviewed periodically, every year is ideal, but at least every 2 years to make sure that, you sometimes, and the law will change and they'll say you need to add a particular resource into your policy. You need to have a specific kind of form, and the form has to look like this. So just making sure that those policies are reviewed, updated, that they, as I said before, actually reflect the company's culture and say what the employer wants to say about the organization. I would say, encouraging that open communication, but being mindful of the risk to privacy, being mindful as an organization that once you have information, you are now charged with having it. So having information about employees' mental health is a big responsibility for an organization. And in some ways it is necessary to make sure, particularly in larger organizations, to make sure that accommodations are being given when necessary. But making sure that your policy is known by HR, that that there's no violation of confidentiality, which is key, and just having that open communication, but making sure that there is a process for everything, a process for asking what accommodations are going to be, a process that everybody knows about, not just HR, but that employees know that this is something that they can ask for. And then I think just thinking about retaliation. So I had a recent example where I had a client who had some mental health issues, and the organization had this survey, well-intended. It's always well-intended. Well, not always, but most of the time it's well-intended. Gives this survey. We want to know, tell us how you're feeling. Tell us if you have, a mental health disability. And then he disclosed it. And what happened after was he was already a person that had a performance concern. And so the organization now is going to act on the performance concern. That comes right after the disclosure of a disability. And that is a legal risk because it's retaliatory or could be perceived as retaliatory. So, having that process with performance concerns is also really important, and sticking to that, because once you have that information, you now have that information, and what you do with that information is really, really important. And also how you're handling performance concerns with people who have disclosed things to you is key, and will keep employers out of a lot of trouble if they have a process.
Great, thank you. So we're going to shift a little bit now. We wanted to, because I know we only have 50 minutes left, and we're very cognizant of of people's time. So we just wanted to shift a little bit and, you know, talk about resources a little bit, and then we'll take some Q&As that people might have. So I just wanted to talk a little bit about resources. And, you know, Ashley, Alexandra, jump in on that. But I did want to say that from our perspective, again, as we said throughout this last 45 minutes, is there is so much more discussion of mental health. We saw the governor's budget reflected, you know, $1 billion for mental health across the country. More and more people are talking about mental health, and it's a great trend in many ways. So we have a lot of resources. Our organization has a lot of resources, as well as I'm sure as Ashley and Alexandra, yours as well, and talk about that in a minute. But I did want to reference a few things from our end. We do have something that we do a lot of training on called mental health first aid. And it's an 8-hour training that is an exemplary best practice that essentially treats people, you know, it's 8-hour training that talks about all aspects around mental health and how you respond to a mental health crisis. And from a workplace perspective, it's something that, you know, and we've worked with a lot of different workplaces over the years, that it's really important. It's just a basic primer about mental health and what you do when you see somebody is in a mental health crisis. So again, you know, just to, if you wanted to go to our website to find out more about it, you can find out more at www.MHANYS, MHANYS.org. So that's important. Two other brief things, and then I'll hand it over. New York State now, and it's across the country as well, there's a rollout of 988. So everybody's familiar with 911. 988 is the crisis response line that is now available to anyone. That's basically if someone is in a mental health, a behavioral health crisis, so if they have a mental health issue or an addiction issue, they can call that number and they'll get immediate response from a counselor. So that's, you know, somebody who's a professional in the field. So that, again, there's no cost to this at all. So that's an important accommodation. It's important to reference that also. So if people are in crisis or they have employee who's in crisis, feel free to reach out to 988. And the tie into 988 is something called crisis stabilization centers, which are essentially urgent care centers for people with behavioral health needs. We're all familiar with urgent care centers for physical health needs. They're popping up everywhere. Well, now there's funding to create behavioral health as well. So if somebody is in a mental health crisis, if someone is in an addiction crisis, they can go to a crisis, you know, they can reach out to 988. They can get mobile crisis if necessary, or they can go to one of these crisis stabilization centers where they will work with them. It's driven by a physician and staff, so that there's professional staff there that would help them. So again, these things are being, you know, offered. The 988 is on the books now. Crisis stabilization centers will be coming up in the next 6 months, and they're across the state. And finally, and this is legislation that has been introduced by the mental health chairs, Senator Brook and Assemblymember Gunther. It's for anyone who's interested in advocating on these issues. It's Senate Bill 1860, it's Assembly Bill 5299. And it talks about exactly everything that we've been talking about. Two fundamental things happen with this legislation. A, it creates public awareness within the workplace about mental health issues. It's essentially, you know, everybody's familiar with the OSHA pieces where you put them in the conference room and sort of talk about public safety. This would essentially create the same thing for mental health. So there would be a mandatory one-pager that would be set up in conference rooms that would talk about mental health services and who you call in a mental health crisis, what you can do around mental health. And the other piece of this legislation is it creates a framework within the Office of Mental Health and Department of Labor and Department of Human Rights. It creates a framework for guidance documents for people who are, you know, having mental health related issues right now, how they can respond. Much like the conversation we had, it puts it in writing, sort of like, here are the best practices. Here's what's people's ability to go in and be able to receive those services and have any of their questions answered. So we're really trying to make an effort to, you know, things to make the issues much more accessible and much more about public awareness. So that said, Ashley, what, you know, can you talk to resources for a minute as well?
Yeah, and I have to say, so Glenn introduced me to mental health first aid, and we took some action right away. We have a social emotional learning group at WGU and reached out to them, and they were incredibly interested in it. And then we've got some of our faculty managers and some other employees that are actually going through it as part of a pilot. And so just sharing resources, I think, it might be commonplace to you, but you never know who might benefit from
Yep.
it.
Mhm.
I found out when I was doing a different cert last weekend, SHRM actually has a workplace mental health ally certificate that goes over foundations of mental health. It does get into some suicidal behavior competencies and safety planning around that, different types of effective communication for mental health awareness and advocacy, how diversity and bias influences mental health, and then substance use disorders. And so it's targeted not just for HR, but for anyone that's leading people, business owners, any employee, I think, could benefit from it. And then one of my coworkers who is a huge mental health advocate, she has gotten me aware of the resources through the National Alliance of Mental Illness, and they do these walks across the country that I think could be a really, really nice team building exercise, because it's for mental health for all. And so it could be a neat way to just kind of start laying the foundation that it's okay for us to have these conversations and to talk about resources, share what we feel comfortable sharing. Of course, to Alexandra's point, be prepared if someone shares with you how you need to respond to that. But someone may not feel comfortable sharing their personal situation or even just being a part of these conversations yet. But getting them out and doing something like a group walk or exercise to support an organization and a community, sometimes that can be a really nice way to sort of break the ice and get them to feel more comfortable with it. So I just wanted to share those as well.
Yep, that's great. Thank you. Thank you, Ashley. Alexandra, from your perspective, any resources you'd like to share or talk about?
Yeah, sure. From my perspective, the EEOC is a great resource. Their website, they have Q&As that discuss employer obligations and employee rights. Having familiarity with what the EEOC says about its own rules and regulations is a great resource. And then every state, including New York, the State Division of Human Rights, all of these human rights agencies do generally produce things like sample policies that you can use to model your policy after, and you could literally like download them, copy paste the whole thing, and it's compliant with state law. If the State Division of Human Rights says that it's compliant with state law, which by the way also means it's compliant with federal law. So having those agencies and familiarity with their websites, and then also, just having a good employment lawyer that you can call. Potomac Law Group has a number of great employment lawyers, and we review handbooks all the time. So just having, I think, those resources in your back pocket if you're in an HR role or leading an organization is key. And then just making sure that everybody knows what the policy is, having training that's internal so that people know what the policy is and how to ask and what to do. Those are all things that I would recommend. And then of course, SHRM is a great resource.
Great. Thank you so much. I'm looking for Tom. Do we have any questions? I haven't seen any come through, but that doesn't mean they're not there because I'm
No,
not
if anybody in the audience has a question that you would like Dr. Jugger or Professor Howell to answer, please do put it in the Q&A panel.
So until such time, I just want to really, if we don't get any questions, I just want to thank Alexandra. Thank you, Ashley. You both a great font of information. Was there any final comments you would like to add before we close out?
I was just going to say, I know one thing that I feel sometimes, and I've seen other professionals in HR and leaders feel, is when you go to a webinar or a conference and you feel really energized by the discussion and you're excited about it, but then day-to-day work life sort of takes over and we lose that momentum, is, try not to delay. Because I think if we say, okay, I'm gonna put this on my calendar for like 2 months from now and I'll get back to this, do something small so that you're starting to take action. in this particular topic for your workforce, get it on your calendar for this week. Even if it's one little thing, like just putting a timeline together of things that you want to do, something that is action oriented, so you don't lose the momentum from the discussion today.
Great, thank you.
That's a great idea.
Alexandra? Yeah.
You know, as far as something you can take action, I think one thing that you could just do right now is look and see that your organization has a policy that addresses mental and physical health, making sure that it exists, knowing where to find it, and then just taking a look and seeing, like, does this reflect the culture that we want our organization to have? And just kind of asking that very simple question is one thing that you can do right now. And I also just want to thank Western Governors University and Albany Law School for having me. This was such a pleasure. Thank you so much. And for anybody that wants to register for HR negotiations, I teach it in the fall.
I think everyone
That's great.
for that.
And one of the things that we cover is negotiating accommodations, by the way.
And I agree. We all could use that. So thank you. And I just want to close by just saying that, again, mental health is real. This is serious issues. When you're talking about now over a third of the population talking about a serious mental health issue, when you have a number like 30% of young women under the age of 18 thinking about this, there are consequences to this. And I think more than ever, things like these kinds of conversations and this kind of work around promoting good mental health in the workplace across the board is so essential. And really, if people feel the need, if they have questions, if they want to reach out, they can come to our website. We have links to all kinds of resources as well. So please feel free to reach out. We understand honestly how real these issues are. We deal with it every day. So that said, again, this is why I really appreciate Western Governors University and Albany Law School for holding this event. So
Glenna, there's a question in the chat that I just wanted to address really, really quick. The best way to communicate to a supervisor about HR concerns around mental health, my advice is to communicate directly. Don't beat around the bush, don't dance around it. If you have something that you need, you should ask for it directly. Say what's going on and ask the question and tell them exactly what you'd like. That doesn't mean you're going to get it. But it does at least start the conversation. The employer has a legal obligation to engage in dialogue with you. And sometimes that, the reason why I say directly is because of the case law talking about earlier, and the EEOC actually has a Q&A on its website about specific examples of what constitutes a request for an accommodation and what doesn't. So you can look at that and see that direct communication is essential.
I agree. I was gonna say they can't help accommodate what they don't know about, right? So, and I always say, like we say, documentation is the number one focus in HR, but I think for employees too, if you have met with your HR department and you have given them notice of a disability or a request of accommodation, keep that documentation for yourself as well.
And if you're an organization, make sure that you have documentation of the conversations that are happening, what is said, so that there's no miscommunication or misunderstanding about what was said, what was asked for. And you don't have to tell everybody your medical history, by the way. You can be, give the information that you feel comfortable giving, but when it comes to asking for an accommodation, you need to be direct.
If you don't record it, it didn't happen. I remember that's drilled into me from years ago. So, Tom, it's all yours.
Perfect. Thank you very much, Glenn. And Glenn, a sincere thank you to you as our moderator today, as well as Dr. Duggar and Professor Howell for sharing your invaluable insight and providing the tangible resources really at the end. I think that many of our audience members will be able to take back and put to use right away. I want to send a special thanks again to WGU for their collaboration on helping make this event possible, and to our attendees, thank you for spending a valuable hour of your day with us, and we hope you all have a wonderful afternoon. That concludes today's webinar.
Thank you.
Thank you.
Bye.
Take care.